It's like we are live streaming, folks. Boy, it says it up in the corner and everything. So I'm getting so good at this. It's really funny. We do our rural caucus, and I do the Zoom meeting for that. But it's so funny how we're still trying to learn. Even people have been on this, how to raise your hand, how to do this, how to do that.
Mm-hmm.
And what's really classic is this muting and unmuting. And some of the things you hear from people while they're getting ready for this meeting. I've learned some new words. I guess they're adjectives. I guess I could call it that.
Descriptors.
There you go, descriptors.
Does that go with preceptors?
Oh, come on, you guys. Hey, let's hope the preceptor bill doesn't get caught up with the language of the new stimulus coming down.
Understand. Melissa, if it's okay, I'll call you after this meeting. I got something for you, my dear.
Can you call around 11? I got a 10.
All right, absolutely. Thank you.
We've got the flag up, Steve.
I know that because we're going to do a pledge soon in 3 minutes. Is that right?
3 minutes. I'll sit down again then.
Yeah. It's kind of like Pavlov, like flag up, you get up ready to pray or pledge. I like that.
She's just not. She was under out. She's not.
Morning, Steve.
Morning.
Delegate Jacobs is having a meeting, so he can't join us.
Okay. Well, we got several people that can't join us right now because we're getting busy.
Okay.
Once we get started, we'll have a minor announcement. I don't know what that is, but I think it's landed. Feel like I'm watching a ball drop in New York City. This wanting to start exactly on time thing becomes like an issue with people, and I have this issue where I like to start on time. So you sit here watching a clock and like feel like a little puppy dog waiting to be fed.
Hello, good morning.
Good morning.
So there's no more revenue coming.
All right, looks like the starting line's here. Good morning, everybody. We're live streaming, so if everybody can do two things. One, make sure you're all on mute, and we'll get started if we can with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. And I believe today we have Senator Eckhart's going to do our prayer.
Thank you very much. If you all would join with me, I'm going to open this. Bless the Lord, O my soul, and all that is within me. Bless his holy name. Our great God, we thank you for the opportunity we have to gather here together in your name to do the work of the people of this great state of Maryland. Thank you for keeping us safe, for bringing us all back together, for being in our hearts and minds as we deliberate the work of the people and do your will. Dear Lord, in these times where we're coming out of a pandemic and we're trying to get the economy up and going again, help us make good decisions and help us have a sensitivity to the needs in our community and bring us safely for a wonderful weekend. And thank you for the warmer weather and all of the good friends who work with us. In your name, amen.
Amen. Thank you, Senator. That was wonderful. A couple things. We do have some people, because we are getting into that part of the year where sessions crunching us a little bit. Next week, the 26th, next week is the 19th. We will not have a meeting on the 19th because that's going into crossover. However, on the 26th will probably be our last meeting, and we're putting the agenda together. I know we have a couple people that we needed to get in and fill that. You guys will notice even today on the call, we got a couple of people that are working on some subcommittees and some special projects, so they will not be in attendance. That being said, I do need a motion to approve the minutes from last week.
So moved.
Do I hear a second?
Second.
All those in favor? Aye.
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 Okay. All right. I guess we're ready to get going. And today we have our Behavioral Health Coalition. Katie Dilley, the Executive Director of Midshore Behavioral Health. I believe you're up. Are you with us?
I am here. Good morning. Nice to see you all.
Good morning.
Thank you, as always, for making time to welcome our Eastern Shore Behavioral Health Coalition. Do we want to go around and do brief introductions of our group that's represented? We could probably do that swiftly if that would.
You can do that. We have you till 9:35. So
Okay. I want to make sure I give allow the opportunity for our group that's here this morning to introduce themselves. So I'm going to go to my right, and I see the first person from our group on screen is Maggie Thomas.
Was not expecting to get called first. Thank you, Katie. Good morning, everyone. Maggie Thomas. I am the Queen Anne's County Local Addictions Authority, as well as the Director for Drug, Alcohol, and Prevention Services for Queen Anne's County.
Thank you, Maggie. Next, I see Dimitri Kavathas.
Dimitri Kavathas, CEO of the Lower Shore Clinic.
Thank you, Dimitri. Next, I have Beth Ann Langrel.
Good morning, everyone. Nice to see you all. My name is Beth Ann Langrel. I'm the CEO of For All Seasons, the Midshore's Behavioral Health and Rape Crisis Center.
Thank you, Beth Ann. Next on the screen is John Plaskin. I know his ID on the Zoom screen is Katie Schoonover, but this is John, actually John. So John.
Yes, I use Katie's Chromebook, so she devours any knowledge of my use of that book. So John Plaskin, Executive Director for Crossroads Community, Inc. and Corsica River Mental Health Services, Inc.
Thank you, John. Next, I have Jerry Jones.
Good morning, everyone. My name is Jerry Jones, and I'm the Clinical Director for Wraparound Maryland.
Thank you, Jerry. Lori Doyle.
Hi, good morning. Lori Doyle with the Community Behavioral Health Association of Maryland.
Okay. Melissa Lubrano.
I'm Melissa Lubrano. I am in my final year master's student working as a social work intern at Midshore Behavioral Health. Good morning.
Thank you. Jasmine Davis.
Good morning, everyone. My name is Jasmine Davis, and I'm with Midshore Behavioral Health.
And I just really quickly want to take this moment to thank Jasmine for her leadership of our Eastern Shore Behavioral Health Coalition. She has kept us on path and informed and organized, and is always supporting and communicating, I know, with this group on the Eastern Shore delegation. And I just want to express my gratitude for Jasmine. So thank you. And Bridget Keeley.
Hi, good morning. I'm Bridget Keeley, and I work at Midshore Behavioral Health.
Ann Sempers.
Hi, I'm Ann Sempers. I'm Behavioral Health Coordinator at Midshore Behavioral Health.
Great. And I think that's all of our group. I will say, I know Sarah Rich is here for a presentation for Chop Tank, but we've recently, as of this week, added her behavioral health director as a part of this group. So perhaps next year when we present to you all, we will be also having Chop Tank represented. So they're a new member of our coalition. So it's exciting that we're here together this morning, Sarah. So we always like to initiate our time with you all with starting off with just an expression of our gratitude around your support for the Keep the Door Open Act and the ongoing advocacy that you all on the Eastern Shore bring for behavioral health. I think it goes without saying, there's so much going on in the state, and the ongoing commitment and dedication to supporting the Keep the Door Open Act and our providers and how they're reimbursed is absolutely outstanding. And we just want to take this opportunity to express our gratitude. This year was unique in the support that came, a little early from Governor Hogan with the increase of the 3.5% rate increase to our public behavioral health and community behavioral health providers. That was initiated back on January 1st. So normally we'd be using this platform to be requesting just continued endorsement and session for that moving forward, but it came a little early this year. So we really just want to thank you all, and we look forward to that continued support regarding, how we fund and earmark funding in the budget to continue to make behavioral health services a priority. And I think this year with the COVID-19 pandemic, it goes without saying, there's been a lot of sensitivity from you all to the need to focus on how we organize our funds and prioritize the budget around mental health and substance use services, and how we're reimbursed and keeping our providers well-resourced. So thank you on behalf of our group. I think the next piece on our agenda this morning is related to a more complicated topic, and that is our administrative service organization and all the developments this year that we've been year and a couple months now managing related to the new leadership of Optum Maryland and the transition and the complexities that have come out of that transition. So I'm going to pivot and have Lori Doyle really lead us in this discussion. And we've got a couple of providers this morning that have been so gracious to provide some personal feedback from their experiences at the provider level as to how this transition has impacted the ability and the administrative stress and financial stress of being a behavioral health provider here in the state. So Lori, if you would, thank you so much.
Thanks, Katie. So good morning again, everyone. And I know most of you have heard about Optum, the ASO, the Administrative Services Organization, and how dismal their performance has been since they took over in January of 2020. That resulted in the department having to give advance payments to providers because they're the two main functions they're supposed to do, authorize services and pay claims, they clearly could not do, and unfortunately still can't do with any consistency. So providers are millions of dollars out in outstanding receivables. And out of desperation, we went to statute to find some sort of way to fix this problem. And we found that indeed the ASO is held to the Maryland Prompt Payment Statute in the insurance article. So we went to the MIA, the Insurance Administration, and said, look, can you impose the penalties that are allowed under that article on the ASO? And the MIA said, well, we'd love to help you, but we don't think we have statutory authority to do so. So that's exactly what Senate Bill 638 and House Bill 919 does. And it would, we actually worked with the MIA. They drafted the amendment language to make the bill stronger. And the bill has passed out of finance unanimously. It passed off the Senate floor on second and third reader, again, unanimously. It's an emergency bill. So it's now sitting over, reassigned to HGO, and we're hoping that the House committee will conform the bill to the Senate version and pass it out. This is just so important when providers are trying to continue services during a pandemic and can't get basic revenue cycle management issues addressed. So we thank everyone. I wish Senator Hershey was here. He was a great supporter of the bill. But we thank everyone for their support, and we hope we can get this out of the House soon.
Okay, I think we have 3 providers that have volunteered to provide just a little reflection on their experience with Optum. I believe Beth Ann is first on that list. So Beth Ann, anything you would like to share?
Good morning, and thanks, Lori, for framing that so well. I think, as we have gone through this past 12 months, and especially since January when Optum has taken over, from the provider standpoint, it's been really challenging to be able to carve out enough space and time administratively to deal with the pandemic and the shifting and the pivoting that we've had to do as a mental health agency. When you couple that with the fact that we are all needing to be on countless calls throughout the week to be able to discuss, Katie has done a phenomenal job of keeping our Eastern Shore mental health delegation and providership together, but it was weekly calls where we were doing nothing other than trying to navigate a broken system, when where we really needed to be spending our time is working with the stress and the lack of productivity that was happening on Optum's side with our own teams. And so I think, the fact that this bill has been passed unanimously, and it says that, if they fail to make the claim, there's going to be a 1.5 to a 2.5% pay of interest. I hope that happens for our folks, because not only is it an administrative burden to our team, but it also is an administrative nightmare to think about forward planning when we're having a difficult time being able to think about any sort of long-term plan, no less the short-term plan, when funds continue to not show up. And so I think the major stress on our staff, and then having to double back time and again to relook at this and think about things differently is really, it's
Yeah.
stress
Pull
on top of a
mine
really
out of the
time,
printer.
and we didn't need more than was already on our plate.
Thank you, Beth Ann. And yes, we have since March of last year, actually March 18th, I believe, we've been hosting provider calls on the Eastern Shore that capture online counties. And actually this afternoon we have a call, and given just the ongoing gravity of issues with Optum, we actually have their Mid-Atlantic and regional provider relations person joining us this afternoon, because there continues to be issues despite some of the progress that we've made. So that's an open invitation to any of you. If you're interested in just listening in, those calls have consistently been going on every other Friday. I know Senator Eckert, I have to thank her for joining us. I think she's only missed one in a year. So it's been wonderful to have that visibility and to have real-time feedback from our providers. So thank you. And of course, the invitation stands if you would like to participate. And I don't know if either Dimitri or John wanted to add to that before we move on to telehealth. I think Beth Ann summarized it pretty nicely with how the provider, from the provider voice, but certainly want to open it up if there's any other thoughts before we move on.
Well, I'll say a couple things. To summarize the main issues, processing claims and then having erroneous denials of claims and then having to reprocess them 2, 3, 5 times. Then actually getting fixes from Optum where they'll have a correction code and then resubmitting the billing with the code, and then their system still doesn't recognize it and denies the entire batch that took somebody 40 hours to put together, is just completely frustrating to our finance and billing staff that this has been going on for months and months. It's just a real example of the, it kind of makes our size agency and then going through claims line by line to try and fix them. It's equivalent of trying to operate an organization 3 to 5 times our size without 3 to 5 times the staff. So I'll just leave it at that. Thank you.
Okay, Dimitri's good. So we're going to move on. John, forgive me, Beth Ann, you are up with John for telehealth expansion.
Sure. So House Bill 123, Senate Bill 3 is preserving our Telehealth Access Act of 2021. The onset of the pandemic prompted telehealth to be validated as a method of delivering care and expanding and including audio-only services. We've always been able to have telehealth services with our psychiatrists. This opened up for both our nurse practitioners and our therapists to be able to provide telehealth. One of the things that we found as a rural care provider, and I know that our sister agencies share in this, is that some of our folks were unable to do telehealth services in video format, either because of technology restraints or because of internet that wasn't available. And we started to be able to work in, at some form, audio-only services. And this bill is to extend this definition of telehealth through from July 1st, 2021 through June 30, 2020. States such as Michigan, Delaware, New Jersey, and New York and Virginia are also following suit alongside of Maryland. One of the pieces that's really important to call attention to in this bill is that the bill requires reimbursement at the same rate as in-person services. This becomes really important for all of us who are outpatient mental health providers and do not get daily rate reimbursements, but are reimbursed at a rate in which services are delivered. Currently, some of those reimbursements for telephone services are as low as $25 for a session versus the average of $100 for an in-person session. Our costs don't shift when we are doing services over the phone. And so I call attention to this one of the bill because of the importance of us being able to have consistent reimbursement in a different delivery service, and making sure that we continue to look at the efficacy and the parity impact by December 1st of 2022, making sure that we are checking in and looking at data metrics and looking at the analytics that come along with this. But this is really imperative for our older population, folks who have internet and in the middle of a session, their internet or Zoom clicks out. It allows us to continue to expand our services as behavioral health providers. It operates us in a completely different manner that allows us flexibility for our staff members and our clients who are still juggling virtual school with children and may not be able to be in a place where they can get to an actual office for services. And it really just allows us to fill out our entire mental health provision that we can provide to the communities that we serve. And John, I don't know if you have anything else that you want to add.
I'll just emphasize the access. I mean, that the accessibility factor is critical to clients on the shore. So I think most providers have a hybrid model where the clinician could be in the office and the client's being seen at home. We have clients who don't have the capability at home, so they come into the clinic and the clinician might be there or at home. And our prescribers are able to, well, clinicians as well, you can serve multiple counties, multiple locations in the same day, just by switching from, one encrypted call to another. And so the flexibility and the accessibility are really critical to maintain moving forward. Thank you.
So I think Lori and John are going to touch on the nurse practitioner component next.
Lori, you want to go ahead and start, please?
I'll just say first off, thanks to Senator Eckhart for putting the bill in. And the really great news, and I think, Addie, you're probably well aware of this, is they've taken your language from that bill and incorporated it into the telehealth bill that we just discussed and actually broadened it. So if it hadn't been for you starting the ball rolling, that language wouldn't have been lifted and put in telehealth. And now we can actually look forward to these telehealth provisions continuing for not only our ACT teams, but for other kinds of services and programs. So thank you so much.
I'm going to reiterate, because I actually testified in Annapolis on this bill a couple years ago, and with the emphasis that it was limited to psychiatrists at the time, and it was essential to open it up to nurse practitioners. And my main argument was that we couldn't find a psychiatrist, for one, to be able to recruit one. application wise, it was like 8 to 10 nurse practitioner applications would come in versus one psychiatrist application. And I can tell you, since this bill was put in place, we have had no problems whatsoever providing our mobile treatment services through this telehealth method. And so thank you again for supporting it then, and I hope you support the termination of the sunset. Thank you.
Thank you, Lori and John. Now we're going to go on to, we feel that it's important to just illuminate some of the impacts, especially related to the COVID-19 impact and what we've seen in terms of trends. And unfortunately, the Eastern Shore has been very hard hit with the increase in overdoses and opioid-related deaths, as well as we're trending up with suicide-related incidents as well. So I'm going to have turn it over to Maggie Thomas, and she's going to be presenting some real-time data and just the impact on what's happening here on the shore with related to overdoses. Maggie.
Thanks, Katie. Good morning again, everyone. So I sort of wrote this as a brief paper because there's a lot of points and I wanted to make sure that I sort of hit all of them. So bear with me if it sounds a little strict in the right. House Bill 396 and Senate Bill 279 support the creation of 6 overdose prevention sites in the state, which are essential as the following overdose data points that I have gathered from various sources like the CDC, SAMHSA, local health departments, as well as the Opioid Operational Command Center, really highlight the need for harm reduction and accessibility to services and resources. One of the first points I'd like to share with you is, which I'm sure you're painfully aware, is that starting in 2013, fentanyl has been on a consistent upward trajectory as the primary causal substance for overdose deaths, while other substances show a clear decline. Fentanyl is being used in place of opiates, either intentionally as requested by the consumer or by the supplier to increase profit while they're maintaining potency. The Eastern Shore has not been exempt from this increase. The Eastern Shore, which as you know consists of Cecil County at the north down to Worcester County, has experienced opioid-related intoxication deaths at 35.7% in the last year alone. This is on par with larger regions such as the capital regions, which only consist of 3 counties, who experienced an increase of 34.8%. While those numbers are shocking, it is really interesting when you look at that our population is only 21% of the capital region. It shows how big the impact are the losses to our families, neighborhoods, towns, and businesses. It's really massive. In addition, the number of total drug and alcohol-related intoxication deaths by age group show an interesting change from the prototypical person who is thought to experience substance use disorder, which would be in the age group of 18 to 30. All age groups have experienced sharp increases in overdoses since 2015. However, all of the data show decreases in the age groups except for 35 to 44 and 55 and older, which continue to increase. If you want to look at race and how it has been affected with overdoses as well, while there has been a positive downward trend that started in 2017 for the white population, there's also a negative trajectory for Black overdoses. They have continued a very steep climb, and Hispanic overdoses have maintained a continued gradual increase. This variance may be due to cultural differences and stigma experienced by each group, perspectives on behavioral health, substance use, obtaining services through either the public or private behavioral health care system, as well as lack of adequate outreach and communication on behalf of providers. If we're to look at the data in regards to female and male overdoses, excuse me, male overdoses are significantly higher than females, males equaling almost 1,800 for the past year, and women just over 600 in 2019. This may coincide with the health disparities along with suicide, as Katie was mentioning, as the crisis response data shows that females were more likely to reach out for assistance from 211 and mobile crisis services. So as you can see, there is much work to do on the shore to provide access to harm reduction services and to increase the reduction in overdose deaths and education and substance use for public health. Thank you so much for your time and attention in this matter.
Thank you, Maggie. We're covering a lot of ground here. I know we're running up on time, but we'll get there. Next up is Melissa Lebrano is going to brief us on the impact with some of the suggested legislation on our essential employees and our behavioral health providers.
Thank you, Katie. Thank you all so much for your time. Senate Bill 486, House Bill 581, the Maryland Essential Workers Protection Act, I like to think of as the pots and pans that we can bang on, just like New York and a lot of other localities did, to salute our essential workers, our first responders, our healthcare workers. What this bill will do, and the number of subjects covered are substantial and comprehensive. Almost every employer on the shore would be affected by the bill, but I think that that's what gives it its power. And I think of President Biden and the talk of shared sacrifice. I think it's important for us to remember these workers, and the bill that would help with extra hazard pay, paid leave, the right to refuse work if the worker feels like it's dangerous, and assistance with healthcare costs, co-pays, premiums, obtaining and paying for healthcare, and the development of a health emergency preparedness plan. A lot of things that we should have already had in the works, but the pandemic has brought into stark relief for us to take care of. So I would love to be able to bang my pot and pan when we pass this bill and give those protections to our essential workers. Thank you.
Yeah, I think just to reinforce just consideration on how that transcribes to budget too, it's kind of circling back up to our opening remarks, as we all are in agreements around the essential employees support. We want to make sure that we toggle that to the funding too. So I see where Lori's come off as well, probably just to plug a little bit of that too. So I'll let Lori offer some remarks.
Thank you, Katie. I guess, as probably all of you are aware, there's a work group going on around the Essential Workers Bill. And while we in spirit applaud the essential workers, and obviously I think all of our individual providers would want to do a lot of the things that are incorporated in this bill, we're very concerned about the impact on human service organizations. And so these work groups that are going on right now that meet every Friday morning involve on one side the unions that are of course for the bill, and the chambers of commerce and the retail federation, which of course are opposed or have concerns. But there's no one really speaking about the healthcare field and the organizations that provide services to people with disabilities. And this bill is big, and I sure don't want to go into all of it, but a couple of things just to think about are things like patient abandonment. So if people can just not show up if they feel unsafe, what happens to the clients we serve? We have staffing ratios that are required under regulation that would be impacted by some of the provisions of this bill. And of course, the costs associated with hazard pay and paying out-of-pocket insurance expenses. Our providers' rates are set by Medicaid. They cannot pass those costs along to the consumer. And so they would have to find a way somehow, and that would come out of service delivery to comply with this act. So while agreeing with the spirit of the act, I think we have some really serious concerns and would hope that the work group at some point in time would listen to someone from the healthcare field to talk about the differences between what we experience and what retail, for instance, and their concerns. And I think you're going to see some amendments from a group of folks in the healthcare field, and hopefully the work group and others would take a look at those. So thank you.
Thank you, Melissa. Thank you, Lori. And just in closing, just a reminder of the strength of the group for the behavioral health system of care design group that out of the, in response, I should say, in 2019 to the chairs of the Senate and Finance and Healthcare Government Operations Committees, just a reminder of the good work that's going on sometimes behind the scenes with our several of our stakeholders in the state, and I'm sure several of you have sat and served and at least listen in on those groups, because I believe they are open. So just we're pleased that there's progress, and the group has resumed meeting. I know there was a hiatus there for a little while during the pandemic, but they have reintegrated, and they are meeting again and back on track with looking at our Medicaid services and our administrative service organization and how our behavioral health providers are supported in the state. And of course, looking at cost management, quality, parity, and just overall, quality of services that we have available here in the state. So just a reminder of if you are not always keeping a finger on the pulse of that group, I know they are paying close attention to how our system here in the state is working, and how our behavioral health providers are supported. And certainly we appreciate that your support with the ongoing organization and activities and I should say recommendations that come out of that group. So thank you for your support. And of course, always a pleasure to be here. I think if we have any minutes left here on our time, we're open for some questions or comments, and always available to be a resource to you all outside of just these opportunities to meet on Friday morning. So don't ever hesitate to reach out.
Okay, thank you. We have about 4 minutes left for questions. So those of you that want to ask questions, let's, if we can, keep it brief and maybe get offline with the folks later. First up, we have Senator Carrozza.
Thank you, Mr. Chair. I want to thank all the organizations that have come in this morning under the behavioral health organizations from the shore. I came in a little late, so it might have already been noted, but I know there was, we've been focusing on telehealth and especially how important that is during COVID-19 to continue some of these telehealth services after the emergency. And I wanted to bring 2 bills that are moving through. And I think one particularly, since I received a lot of support for my bill that is SB 646. And what it does, it permits the alcohol and drug trainees to continue to provide telehealth services after the emergency. And received, I think, over 25 letters of support from the various behavioral health organizations throughout the state. And that bill is moving through. And I also wanted to note on telehealth that the occupational therapist compact, which of course a district like mine and some of my other colleagues where we my district borders Delaware to the north and Virginia to the south, that compact becomes important to provide increased access to services. So that occupational therapist compact bill is moving as well with telehealth as part of it too. I did want to note the conversation about SB 279 and just flag that I'm hearing concerns and resistance, at least from the lower shore on that, given everything that the local health departments have to do during COVID-19, that, looking at this bill as kind of something else to put on their plate at this time isn't exactly timely or the right thing to do. I realize it is a pilot project, but I'm just wanted to share some of the feedback, at least from the lower shore on that bill. So appreciate the update and want to continue to work with these organizations, especially as we work through COVID-19.
Thank you, Senator. Next up, we have Delegate Mouts.
Morning, everybody. Good to see you. Thank you, Chairman. Lori, so Delegate Aronson, myself, and Delegate Adams, we all serve on Economic Matters Committee, which is where 581 is currently being debated. We're not on that work group. I think Delegate Adams is on the work group. I wasn't aware of the entities that were involved in the negotiations. I know there are a lot of different moving parts, but when you get information, please go directly to Steve, Chris, and myself. So we're getting stuff from you directly, because the next week or so things are, the bills are coming up on voting lists very quickly. We're jamming through a lot of bills. There is not a lot of communication, and it's concerning to me to hear that you don't have a voice in those discussions. Maybe the chairman's very wise. He's not heavy-handed, and he's been very open about this is a work in progress. But I just wanted to make sure you knew that we don't have as much information maybe as you think we would about that bill. So if you have anything for us, please let us know. So, but that's all I wanted to share with everybody. No specific question. Thank you.
Thank you, Delegate. I will do so. Thank you.
Just another note, Senator Hershey's also on that work group. So we have pretty strong representation from the Eastern Shore. And that's good news. Both Chris and Steve, I think, have a handle on that. I know we're running out of time, but I did have a question, and mine's to the schools and what you all are doing. This whole COVID thing and the pressure on the parents and the families. Are you all in communication with anything with involving the schools, with the local school boards as to what you're currently having to handle?
Absolutely.
Is there any impact?
I know we have a couple providers that are serving school systems represented this morning, and our discussion, especially, with our mental health leadership, in each county, has been open and fluid, and with the school system. So yes, absolutely. That's a constant and has been, and we anticipate those discussions and involvement from our end will just be increasing as we have more youth, reintegrating back into the schools. We have been looking at gaps in services to ensure that we're prepared to meet the needs of our youth as they have already demonstrated extraordinary resilience. However, the stress and the impact, I think, is something that we're all sensitive to. So those lines of communication absolutely are open. And I don't know if anyone else wants to comment on that, but we are keeping that as a priority for sure.
What I would appreciate if we could is if there's some way we could get some sort of communication going between us and you all, because I'm getting inundated with parents calling me and talking to me about this, and it is very serious right now. We have kids going through trauma, and we need tools and the support mechanism and the facts from people like you to move that forward. But we do have to get on to the next set here. I apologize, but
right. No, and I think this is always a nice opportunity to remind you all that we're here, and don't hesitate to reach out. I know we have provided our personal cell phone information historically. We can certainly follow up with that. We have a document that captures all of our contact information we can send to you all to have as a resource, so you're not feeling alone or unsupported in managing those questions and inReach. So just to remind you all that we're happy to help.
Okay, even updates or maybe just a briefing at some point, but we do have to move on to the next group.
Yeah.
But appreciate you all here, and you have our support as a whole. I think that's pretty obvious. Next up, we have the Eastern Shore Health Centers, Brian Holland, CEO, Chesapeake Healthcare. Brian.
Good morning. I'd like to thank the delegation for having us. I'm Brian Holland, CEO of Chesapeake Healthcare. I too would like to echo the sentiments of the Behavioral Health Commission. We have about 55 mental health providers on the lower shore, and it's still not enough. So we echo those same concerns that they're having. So it was about a year ago this week that we started seeing the impacts of COVID-19 on our business operations. Almost overnight, when the executive order limiting things to emergency visits, it cut our business in half almost overnight, and it led to some pretty tough decisions. We had to lay off about 130 staff, close 2 of our sites. We started experiencing staffing issues with schools closing and parents having to go out and take care of their kids. I think every business kind of saw that. We also saw increases in our costs due to personal protective equipment, cleaning supplies. Some of those things tripled or quadrupled in price within a month. And thankfully, the PPP, provider relief funding, grant funding, and the expansion of telehealth came along, and it allowed us to weather that storm pretty nicely. And but here we are about a year later, and while we've mostly recovered, there's a few departments that are really struggling still. Adult medicine providers are still down, 15 to 20%. Peds providers are still down 30%, and dentistry it's still pretty dismal. So a lot of those areas are still struggling. Behavioral health is the one area that is unfortunately is thriving. I'm not sure if everyone got a copy of our slides, but as you can see from our slides, we serve about 50,000 patients on the lower Eastern Shore, which is about 28% of the population here. And we did about 33,000 of our patients got tested for COVID-19, with a little over 3,600 of those testing positive, so about a 10% positivity rate. And for each one of those patients of ours that tested positive, we had a dedicated health outreach team that reached out to every single one of those positive patients and made sure they had information related to where they could go, what resources, and linked them to care, just to ensure that they had the best possible resources to get over the hurdle of COVID-19. And lastly, I want to touch on, I think, something near and dear to every health center in Maryland's heart, the issue with vaccines. I know everyone's struggling with vaccine supply, but another issue with that is the consistency and the communication surrounding those. The inconsistency of getting those and the lack of communication makes it really difficult to plan for those and to give those. And we are very fortunate to have a great team and a dedicated space, which allows us to pivot very quickly. But I don't think that's the same for all of the organizations. So with that, I'll hand it off to Sarah.
Thanks, Brian. Well, good morning, everybody. I'm Sarah Rich. I'm the CEO here at Chop Tank Community Health. And I want to thank you for taking the time to hear from us this morning, to learn a little bit more about our organizations and how we've responded to COVID, and especially how we're supporting the vaccination efforts here in Maryland. And just want to thank our behavioral health colleagues for all the great work that you've been doing throughout this challenging time. Appreciate your partnership there too. Thanks to Katie and her team. Just to kind of set the table, we are a federally qualified health center along with Chesapeake Healthcare and West Cecil. And federally qualified health centers really started at the grassroots, the local level, dating back all the way to 1965. And now health centers have grown across the country, and there are more than 1,400 of those nationally at this point. 17 of those are here in Maryland. Nationwide, health centers serve 29 million people. And so again, we're part of this larger network, this larger voice, which is really important, especially during these times. So health centers really are looking at increasing access to primary care services, dental services, behavioral health services, and reducing barriers to accessing care. Cost, lack of insurance, distance, as we know, in our rural areas is also a challenge. So it's really important to be able to have health centers in these rural settings, and then certainly language barriers. So health centers really do play a critical role in ensuring that access to care. And so I just wanted to give you a quick overview about Chop Tank. Some of you I know are very much aware, but for those of you who are not, I just wanted to share, our mission as health centers is really to provide that access to care, exceptional care, comprehensive care, integrated care. And it's the roadmap for everything we do prior to COVID and during to COVID. Really was the driver for the decisions that we made and how we supported the community. Last year, 2020, was a year like no other. We celebrated 40 years of being a health center. It was a heck of a year to celebrate. We didn't get to maybe do some of the things we normally would do, but still very blessed to serve the community. In terms of counties, we're in Caroline, Dorchester, and Talbot County. We have a very robust dental program, primary care, and partner with behavioral health providers. Some are co-located with us, some work with us in the school setting, and we're actually working to stand up our own behavioral health program here at Chop Tank. To kind of give you a sense of the depth and size of Chop Tank, we care for about 30,000 patients annually through 6 health centers. We have school-based wellness programs in all Caroline County schools, 4 in Talbot County schools, and we also have a migrant health outreach program as well. And really important as we talk about COVID, we have about 200 employees here at Chop Tank. So COVID-19, as COVID came, just this last week, I've been kind of reflecting, where was I when I first started hearing about COVID and things shutting down and plans that were made to continue operations. And I think that's really critical for us, those on the call, our behavioral health colleagues. We never stopped providing those essential services, the medical services, the dental services. We stayed open. We knew we needed to take care of our patients, and so we quickly pivoted to telehealth. I would say during the height of the pandemic, when we're looking back last year, August, September, about 70% of our total visits were telehealth visits. And going back, I think it was Beth Ann that had mentioned the challenges with the audio versus video. We experienced the same thing. We're still having a lot of patients wanting to use that audio component. And so ensuring that option remains is really important for our patients here on the Eastern Shore, whether they're behavioral health patients or they're medical patients. One of the things that we did was we were a participant in the Emergency Operations Center here in all 3 counties, which is so critical in terms of communication, testing rollout, et cetera. And so we did start testing really early. We worked with the poultry industry to provide testing to workers there, especially when there were some outbreaks in those industries as well. Today, we are back up with patients coming into our office. We do have a lot of new cleaning measures, safety measures at all of our locations. I think COVID has changed how we provide dental care forever in terms of airflow and what we do with the particles that are circulating in the air. And so bringing people back, and that's one of the concerns that I think we all have. Many people have put their care on hold throughout the pandemic. People who have diabetes, hypertension are not coming in for appointments. And so we're really working hard to let them know it's safe and they need to take care of those chronic conditions. The other piece that I think there's a lot of concern around is pediatrics. Nationally, and then certainly here on the Eastern Shore, the vaccination rates have just declined significantly for kids. And we want to make sure that we're working hard to get those rates back up, that kids are getting in for those well visits. So if there is an issue, that we can address it early. Lots of staff hours in terms of impact on COVID-19 is huge for us, as it is for everybody else. To give you an example, January, we had 41 staff members who were out related to COVID, whether they were in isolation or quarantine because they had an exposure, whether they had a family member they needed to care for that had an exposure. But that represented almost 260 missed days of work for January for us. And so when we're thinking about providing that access to care for our communities, ensuring that we have the workforce in place is huge for us. Making sure that our staff is vaccinated so that they're here to provide that access to care as well. And then certainly revenue impact, as we all know, that's impacted us significantly going forward and continues to as we try to bring people back into care. But there is some light here in terms of the vaccine being available, and we began working with the local health departments to get our staff vaccinated and to assist them in the phase 1A as we started to get vaccine doses. When we get it, we put it in arms as quickly as we can. We would like to certainly get more vaccine, and right now health centers are getting about 100 doses a week from the state. There is a new program from the federal government, excuse me, for federally qualified health centers to receive vaccine. It's rolling out slowly. The intent is not to supplant the resources that are being received from the state, but to enhance that and allow us to do more outreach to our patients and the community as a whole. One of the pieces that's really great about being the health center is that we already are working with those underserved populations. They trust us, they know us, and for that vaccine hesitancy, trying to get more doses in arms, it's really critical to partner with those federally qualified health centers along with the health departments and other providers in the community. Okay, well, I'm going to stop talking and turn it over to my colleague, John Ness from West Cecil Health Center.
Thank you, Sarah. Good morning, everyone. I just want to thank the delegation for having this opportunity. Appreciate all of your service through a very challenging time. West Cecil Health Center, we're on the Upper Shore. We're in Cecil County. We also have a site in Harford County. Majority of our patients, about 7,000 that we took care of in 2020, are in Cecil County. We offer a variety of services. We have a sizable, we're much smaller than my colleagues than Choptank and Chesapeake, but we do have a sizable behavioral health group, and it is a very important part of the services that we provide. And we also have integrated treatment for substance use disorder into our primary care and our behavioral health services, noting that Cecil County is suffering one of the highest rates of overdose in the state of Maryland. We have about 62 employees currently. Go ahead, Sarah. again, our experience very similar to my colleagues on the shore here. So pivoted to telehealth, and I'll talk to more of that in a moment. Very quickly, that became our primary mode of delivering care, and still remains our primary mode of delivering care to this day. That has really helped our patients and our staff stay healthy and continue delivering care to our patients. Just like our colleagues, we struggle in dentistry, had to temporarily close it. It's very expensive and difficult to obtain PPE and testing in the early days. Thankfully, the PPP loans and the CARES Act, if it wasn't for that, we would have been devastated. And as I think about some of the legislation right now and the work in the Essential Workers Act, our revenues were crushed in the beginning of this, as well as increased expenses. It was a perfect storm situation. And I do have some very, big concerns that if we had to also significantly raise our payroll for hazard pay, that would have been devastating as well. So I really need to be mindful of how we would manage to get through a pandemic that has been a year. It's not like a short term. We just get through a couple of weeks, and we could manage that increased hazard pay. But to do that basically for a really long time, that would be a challenge. I'm not sure how we would make that additional expense. Go ahead, Sarah. So we are, as my colleagues, we are vaccinating. We've ramped up, and we've taken in some volunteers and doing everything we can to get our vaccines out as quickly as possible. Very, very welcomed by staff and community members. And we were doing a lot of testing, and that is pivoted. So we're seeing very little demand or request for testing at the moment. And as far as the, I guess my number one topic would be the telehealth bills. And really, to reflect on telehealth as a, not just an inferior alternative to in-person visit, but, an equal or sometimes better modality for delivering care. There's no, it shouldn't be looked at as something that's inferior. It's not always appropriate. And you do have to see patients in person, but I have seen just an incredible response by our staff, our providers, and our patients to the especially behavioral health. Having that access has been incredible. And definitely the voice only is important because of technology issues and access and barriers. We need to have parity with that voice only visits. So just telehealth has been phenomenal. It's saved us through this pandemic, and just really important that we maintain that ability to continue those services. Thank you.
Great, thanks, John. And we just had a few areas that we wanted to make you aware of. I think you probably are on most of these, where we could use support. And I already referenced first and foremost the vaccine supply. We want to move forward and get as many shots in arms as we can. So ensuring that those supplies that are coming into this state are being distributed and looked at in terms of who's getting them and how we're getting those out. When we think about, again, community health centers, we're taking care of those folks who may or may not have insurance, who are Medicaid patients, who have a lot of barriers in their lives. And so to ensure those folks are getting vaccines, we know how to do that as community health centers. We did that with testing, the model of testing for COVID testing. We've now, pivoted, and so we can do the COVID vaccine as well. So I think that's first and foremost on our minds in terms of how we move forward, how we all move forward. And I'm going to ask Brian to talk about the bidirectional interface with Immunet and a couple of the others real quickly. I know we're running out of time as well.
Yeah, I'll try to move quickly. I know the state is working on getting interfaces set up with Immunet and CRISP. We'd like to push for a bidirectional interface directly with Immunet if that's possible, or at least a better interface with the CRISP system. I know adding one more level of failure between the two, and it just increases the delays and stuff getting back to us, and makes it more difficult to us to reach out to patients who've been vaccinated or finding out who's been vaccinated. So any support you could give us on improving those two systems would be great. As Sarah mentioned earlier, nationwide, children are not getting vaccinated at a rate that they should. And capturing kids at the place that we know they're going to be in school-based health centers is vital. Any support you could give us on that bill that's coming up would be fantastic. Preceptor tax credits, we have about 3 to 4 of our providers who love this, and I know there's a bill in there to decrease the hours, so they appreciate any support you give them on that as well. And anyone familiar with the Lower Shore knows that we do about 100% of the deliveries on the Eastern Shore, and any obstetrician will tell you that all of the catching the baby in the hospital is the easy part. All of the care happens prior to them getting there. So anything that can help them get into care sooner and provide that care prior to them doing the delivery, we appreciate that support as well. Thank you.
Hey, Brian, if I may interrupt you, if you have something to do, but I know the House has to go into session at 10 o'clock, and Senator Carrozza will be monitoring the call from this point, but I want to thank you all for being here, but I have to get off. And most of the House does, so thank you.
Thank you.
Well, we just want to thank everybody for the opportunity to share a little bit about our organizations, what we've done throughout COVID, and where we're going. We want you to know we're here as a resource for you as well. Questions that you have about about COVID, about the vaccine, testing, and healthcare as a whole, we're here to support and provide information. It's part of our mission, and we want to ensure that the residents of the communities that we serve here on the shore are receiving the best care possible. So we thank you for your support and look forward to working together.
Well, thank you all for the presentations, and certainly today's topic was timely given that this was the 1-year anniversary when everything began to shut down. And the updates that you provided are very meaningful, especially given that initially I don't think there was the focus on how this was impacting our constituents on the mental health side. And, the role that you've been playing and will continue to play is essential. And I think having this information at this point in session, because what some of us have tried to do, knowing that it's a very focused session on COVID-19 relief, with the passage of the governor's, COVID-19 relief package early on, and then these various telehealth and other measures that you brought to our attention. So I want to thank all the organizations. You shared information with us early in the process that was helpful to us in moving many of these key bills. I did want to, I know that our House colleagues had to depart, but I did want to give our federal partners an opportunity to provide a brief update. And again, I'm coming in late here, but I believe I saw Kim Cradaville on from Senator Cardin's office.
Yes, good morning. How are you? Thank you for having me this morning. Very quickly, the American Rescue Plan obviously passed. I know Melissa and Mike will be reporting on that as well. In your inboxes, I sent a comprehensive guide from our office that we put together. So if you have any questions, and please feel free to share that. Also quickly, the senator has, I know we've had some time changes, but most of the folks, the healthcare folks on this call, if you would like to participate in that 4:30 call with Senator Cardin, if I missed you, please, I'll put my email in the chat and I'll send you the call-in credentials. Thank you. I think that was brief, but thank you for having me.
Thank you, Kim. And I believe I saw Melissa Kelly from Senator Van Hollen's office with us.
Thank you, Senator. Thank you, everyone, for your presentations. Always very informative. Joanne will be providing your slides to us, which will get to our legislative team. I appreciate all the efforts you've done with the vaccinations. The senator is keenly aware of your good work on the Eastern Shore. To the delegation today at 2 o'clock, the senator is participating with the MML's virtual town hall. He'll be discussing the American Rescue Plan as well. And next week, he'll be holding a child care Head Start panel. And our very own Christy Morrell from Critchlow Atkins Children's Center here in Talbot County is going to be one of the panelists. So I will be sending that invitation as it becomes available. So thank you. I hope you all have a good weekend.
Thank you. We appreciate the sharing of this information to all of us. And I did believe I saw Mike Ernst from Congressman Harris's office is with us as well.
Thank you, Senator Carrozza, and thank you to all the mental health providers that are on the call. Most of what I have to comment I probably be of interest to you, but I was hoping that all the delegates that have left would still be here for this. Along the lines of the mental health care situation, something that is presently happening, I'm sure is going to impact your field and what happens, and that is all the migrants that are coming across the border. Apparently, there's indication that a fair number of them are going to be coming to the Eastern Shore of Maryland. And so Congressman Harris on Monday put out a letter to Secretary Mayorkas, Homeland Security, with concern about that. But just, you know, as an alert, there's expected to be a fair number of folks coming to the Eastern Shore that are probably going to be looking for some kind of services in many cases. Obviously, COVID-19 concerns in that regard, because they're really not testing people as they're coming in as well. A couple other things real quickly that may or may not be of interest to you. The Army Corps of Engineers is about to start oyster restoration on the Treadhaven River. I was hoping that there was some watermen here, but there's some folks think that's a good thing, and some of our watermen are a little concerned because they are going to be using rock for substrate, and that will be a sanctuary river. Let's see, there was one other thing. Waterman's Relief distribution plan should be just about ready. James McKittrick from DNR was finishing it up, and Secretary Hadaway, I don't know if anybody from DNR is on, hopefully we'll be approving that. And so that will be coming out real soon. And then finally, PPE grant applications are due by the end of the month. And that's it for me.
Thank you for that update. Before we close out, I just wanted to share something on a personal note, given that we're hearing from our behavioral health organizations today. I have good news in that my nephew, who has been a school psychologist in other states, is returning to Maryland and has accepted a position in Charles County. And so we're really excited to, have our loved one back home, and that his services and his commitment to the field will be actually benefiting Marylanders right here at home. So I just wanted to share that with the group. I don't know, Marty, if we're actually cut off at 10:05, if I can call on anybody else, if anybody else wants to say something, since do we lose our time at 10:05, or can I open this up if anybody else wants to make comments?
You could open it up.
Okay. I would like to give any of our participants an opportunity to say a word or two to give us an update or just a kind word. Looks like
good morning, Charlotte Davis with the Rural Maryland Council. Just happy to be here this morning.
Okay.
I think you guys heard a lot from me yesterday on broadband. So
okay. Thank you for that update. That was a very productive meeting. I thought we accomplished focusing on broadband and other priorities.
Anybody? Senator Carrozza, Kathy Bassett here from Mount Air. I was just tuning in today because I love hanging out with the Eastern Shore delegation, especially by Zoom. But I wanted to tell you all that we're working really hard getting all of our employees vaccinated. So a big shout out to Tidal Health that has really helped us. Without them, I don't know where we'd be. because the states have been a little bit slower in helping our own healthcare providers get us vaccine, but we're working really hard on that. And, you know, we got some challenges trying to convince people to get the vaccine. I know that that is a challenge for lots of different groups and communities, but it's a real challenge for us. So any help anyone has on that would be more than happy to take that. But thank you all for all you do.
And thank you for your focus on, you know, expediting those employees to be vaccinated. That's really, that's a priority for all of us. Okay, last call here. Good of the order. Thank you, everybody. Have a safe weekend. Look forward to seeing you next Friday. Take care.
Bye-bye all.
Thank you.